afternoon. I'd like to call this regular meeting of the Lane County Board of Commissioners to order for Wednesday, October 10th, 2018. And I will note that all commissioners are present except for Commissioner Lycan, who is excused for this meeting. He had a personal matter he had to attend to.
And now it's my turn. I welcome to the October 10th City Council meeting. And we're still waiting for Greg Evans, it looks like. Expect that he will arrive. I will just make a quick reminder announcement for how we'll proceed. We will have, as usual, you can wave at me when you wish to speak. We'll begin with a county commissioner, one county commissioner, followed by two counselors, because there are twice as many counselors as there are commissioners, so 1 for 2. And we are holding you to 2 minutes because there are so many people we cannot really get through enough questions and answers. And so with that, I will turn this over to Jason Dietrich to kick us off.
Thank you, Mayor. Mayor, councilors, and commissioners, my name is Jason Dedrick. I am a policy analyst with the City Manager's Office for the City of Eugene. I'm going to give you some quick context on this project thus far and then turn it over to the representatives from the Technical Assistance Collaborative, who we'll refer to as TAC from here forward, and they'll be providing the bulk of the presentation. So a reminder of the goal of today's work session is really this is kind of an interim check-in on tax products thus far. So we really want to get your questions, your clarifying questions, your input on the work they've done thus far. As the mayor mentioned, we'll have limited time, so please do feel free to follow up with staff after, either staff from the county or the city after today. But we'll ask, since TAC is here from Boston, that you can hopefully direct most of your inquiries and comments to them. So this study was initiated earlier this year as a partnership between Lane County and the City of Eugene, with both entities providing funding for the work. We issued an RFP and selected TAC as the consultant on this effort. They are based in Boston, and so we're lucky to have them here today. They have a deep amount of experience working with cities, counties, and states across the country on this work, and staff has really enjoyed sort of their insight. We'll ponder a question and they'll say, oh, this happened here, this happened there. So it's a great resource that we have in having them available on this work. So their work thus far has been working through several phases. They initiated with a large and robust data collection process. So that was taking in all the data that is collected locally, as well as meeting with key stakeholders in the community that are providers in our homelessness system to understand how the system works right now. And so then they moved into an analysis phase, which was crunching all that data, trying to map out what our system looks like, and then start working on their recommendations going forward from here. Today, we're about in the middle of that process, or getting to the end of that analysis process. So again, we're just interim checking in on their work thus far. They'll wrap up with sort of their documentation phase, which is producing the final report of all of their work, which we'll receive in December. So the packet that you have in front of you has a few key things that we wanted to give you so that you'd had an overview of everything that we're doing. So there are 3 documents in there related to efforts that the city and county are undertaking regarding homelessness, just as good background for you. Also, there is the executive summary from TAC. Again, that's just sort of a summary of some of their key findings thus far. Some high points I wanted to mention for us as staff working on this. So far, a lot of TAC's work has helped confirm some of what we thought we knew about our system, but they've added a lot of depth and nuance and sort of an outside perspective on things, which has been great. I'll also highlight that one of the major components of their work has been to document our efforts as a system, as a homeless system in Lane County, and what we're learning about how everything that we do from here forward is tied to everything else that we do, and that those things need to move in concert. So you'll get that feel as they work through this, but really that systems level look is new for us here in Lane County and how we look at homelessness. So going forward from today, tonight I want to mention that Live Healthy Lane is sponsoring a workshop downtown at 5:30, where TAC will be presenting essentially this similar information. We have already maxed out on the number of people that can attend that. It's in excess of 150. So for those of you that might have been interested in attending that, I want to let you know that the video from today will be posted on the county's website. So today's presentation will be like tonight's. At that meeting tonight, there will be some discussion questions that we'll have attendees working on. Those questions will also be posted on the county's website, as well as a web form for anyone in the community to respond to those questions. So we'll take in that information, pass some of it along to TAC. So that's what's happening tonight. We'll be looking for your feedback today as well as in the following weeks. You can connect with staff if anything you want to mention that didn't come up. TAC will also be checking in and hoping to hear from our stakeholders on have we captured everything the right way so they can move forward on their analysis. So again, their final report is due in December. You will likely be convening as a joint elected officials group again in January to formally receive the results of that report. It will be at that point that we will be embarking on a larger public engagement process so that our communities can get involved in these policy and operational questions about what do we do with all the recommendations that we're going to get from TAC. So we'll be looking at much broader engagement with the community at that point. So with that, I'm going to turn it over to TAC for their presentation.
Great. Thank you, Jason. Good afternoon, and thank you for hosting us today. We're really excited to be here. This is, I know everybody's very busy, and so this is a really great opportunity for us to be able to talk to you in this kind of setting. So thank you very much for hosting us and for attending. I'm Gina Schack from the Technical Assistance Collaborative, or TAC. Joined by Liz Stewart and Doug Tatro from TAC. As Jason said, we're a Boston-based nonprofit consulting firm. We're fairly small when you kind of look at the consulting world, but we have done a lot of work. 20 plus years we've been around in Boston, so we've done a lot of work around the country. We've seen a lot of different systems, and we've seen a lot of good things, a lot of bad things, and a lot of really great, new, innovative ways that systems can be fixed or tweaked or kind of move different directions to have better outcomes and results. At TAC, we have two kind of practices. We have a housing practice, which is focused a lot around HUD, so the Department of Housing and Urban Development, the Department of Veterans Affairs, and we also get funding from the Department of Health and Human Services. We do a lot of technical assistance with communities with that. So it could be anywhere from a state, a county, a city, another unit of local government, or actual homeless service providers themselves. So we'll go in and kind of look at what's going on in that community, what their problems are, and what they're doing on the good side as well, and how they can build off of that and provide that kind of technical assistance. So we've seen a lot of different kinds of communities. Sometimes, you know, we've worked in big cities and the whole gamut all the way to rural areas. The second kind of practice at TAC, it's our human service practice. So we do a lot of work around helping states with their Medicaid plans, Medicaid billable services, tenancy support services, training staff to be able to be billable, and a lot of work around behavioral health issues. So you guys, like it's a natural connection to have at one firm, especially even a small firm, to have that connection between the housing staff and the human service staff, because housing and healthcare, housing and human services really go together. Jason gave a really great overview of what we've been doing so far. So I think we can just jump into the presentation we want to talk to you all about today. So, I do want to say, too, so we have about 30 minutes to talk, and we're going to talk about a lot of stuff. And we'll see, we'll talk about our recommendations or the preliminary recommendations. This is just the 30,000-foot overview of it. The report is going to be much more detailed. It's going to talk about implementation, design, implementation, and things in kind of perceived outcomes of what you're going to do. So this is just really, really, in general, brief, laying the groundwork, telling you what we initially found through our the last 6-7 months of analysis we've been doing, and then some of our preliminary recommendations. So we're going to go into much more detail in the report that you'll see in December. So I don't want folks to see the bullets and just think that's it. We've been working off of these PowerPoints for quite some time, and the idea is really these are the backbone of what the report's going to kind of shape, or how the report's going to be talked about a little bit. So this is kind of how we're envisioning the report to talk to that will be the final product. So today we're going to talk about The idea of this presentation is going to be, we picture folks being able to watch this in the future, right? We picture folks being able to access these slides in the future. So we really need to initially do a level set of what is going on here. So it's just basic numbers. So we're going to do an overview of homelessness in Lane County. So who's homeless? What does that look like? Then we're going to walk through in a little bit more detail the system map, which you all have as a handout. And that system map is it's what we found between the stakeholder interviews, the conversations we have, working closely with our team at the county and city here, as well as looking at a lot of data that you all have. So the system map is essentially, we'll walk you through it, but that's essentially your system as a whole and what it looks like. And it points out what resources you have currently, how someone would ideally flow, and then how people get stuck in a way. So it's kind of a visual for that. So we'll talk about that. Then we're going to talk about a little bit about challenges that you all are facing in Lane County, some internal, some external, some you can control, some you can't, but I think it's really important to point that out. And then we'll move into the preliminary recommendations, which I think will be kind of the bulk of this, and then we're gonna talk just at the end around little system modeling, which is basically, if you do X, Y will happen, or if you do XXX, Y will happen. So we just wanna kind of give you a sense of that kind of modeling picture.
Okay.
Hello. So I'm going to go ahead and dive right into talking about the overview of people experiencing homelessness in Lane County. So when we started this project, one of the key things that in order for us to tell you what we think are the best recommendations to solve this problem, we really need to first understand what the extent of the issue is. And so that really required us looking at all of your data on who is homeless, who is experiencing homelessness in Lane County. So this first graph here is data that's been collected from the 2018 point-in-time count. And the point-in-time count, or PIT, as people call it, is a count that's done on a single night in January, where the number of people experiencing homelessness are counted, and that includes people that are living in unsheltered locations, people living in emergency shelter, and people living in transitional housing. But it really is just a snapshot of who is experiencing homelessness on any given night. And so if you look at the graph here, you'll see that your numbers for all people that are experiencing homelessness for 2018 were 1,642. But that, again, is just a snapshot of a single night. When you actually are looking at how many people are served or touch the system in a given year, Lane County estimates from some of the data from their homeless management information system, which is sort of the data collection system that COCs use across the country to get data collected for people experiencing homelessness, the number annually is going to be more like over 15,000 of people that actually experience homelessness at some point during the year. So the point in time is really just, again, a snapshot of one night, but the actual number of people throughout the year is much, much higher. But this is just for all people experiencing homelessness. And what we found, though, when we were looking at the data is that when you're looking at overall homelessness, that the bulk of the issue of people that are actually experiencing homelessness is primarily single adults. So if you look at the graph on that last column there, you see that 1,365 single adults were experiencing homelessness in the 2018 point-in-time count. And of those, a good portion of them, 1,009, were in unsheltered locations. So really what we're seeing is that the problem is much bigger for single adults, and it's even much larger for people that are living in unsheltered locations. So when you look at this next graph, this just is a focus in on the percentage of people who are single adults, across the different years. And if you look at the bottom right, you see that 89% of single adults are in unsheltered populations, or unsheltered locations, and that, again, 83% of folks that are experiencing homelessness are single adults. So that really kind of gave us a laser focus on, this is where the biggest, issue is as far as people experiencing homelessness, and it's something that we really needed to take a closer look at and have as sort of a focus of our analysis and figuring out what the solutions are. So I do want to go through some just demographics too from the 2018 point in time. For all persons experiencing homelessness, the data isn't broken out by single adults, but you'll see that there's a significant percentage of people fall into these different categories. So chronically homeless, 22% of sheltered people are chronically homeless, 53% of unsheltered people are chronically homeless. 38% of unsheltered have some kind of serious mental illness or self-reported serious mental illness. 30% of unsheltered have issues with substance use disorder, and 11% are veterans. And I think one interesting thing to look at here is that the percentages are all higher when you're looking at the unsheltered population. And I think the other thing to just remind you of is that the point in time is, again, just on one single night. So a lot of people are probably not even necessarily telling what their issues are. They may not be ready to provide that information. So I think there's an assumption generally out in the field that these numbers are probably even underreported for what these additional issues are that people are facing beyond just being homeless. So another thing that we wanted to do when we're trying to understand the extent of the issue is putting Lane County into context to see how you guys look when you're looking at other communities across the country, other communities on the West Coast. And, I think what we found just from looking at the data and from all of the different stakeholder interviews that we had is that, again, there is definitely a large unsheltered population, and it is very visible in the community, and it's something of concern. And so when we looked at some of the information that's available from HUD, so every year they do an annual homeless assessment report that goes to Congress. And so when we looked at that data, that comes out of all the different continuums of care that have to tell HUD what their point-in-time numbers are. We found that Lane County COC, when you're looking at just sheer numbers of unsheltered and you just did a list of who has the highest number of unsheltered to who has the lowest, Lane County is actually 42nd out of 399 continuums of care across the country. So, yes, there's a Los Angeles, San Diego that are at the very, top. Seattle's up there too, but you're in the top 50. And so I think for a community of your size, like that's meaningful. And then the other thing that just through our data collection, looking at the annual homeless assessment report, within that report itself, Lane County is called out when looking at smaller city, county, and regional COCs. So HUD groups COCs in sort of these three buckets, and that's the one that you guys fall in. That of those across the nation, Lane County ranks 6 in those people experiencing chronic homelessness of single individual adults. And so for those of you that might not know that term, chronic homelessness, that means someone that's has a disability and has been continuously homeless for a year or more, or had multiple episodes over a 3-year time period. But so it's people that really have been dealing with homelessness issues for an extensive period of time and have some kind of disability as well. And so, I think that's saying a lot to know that you're 6 in that. And then when just looking at just sort of the extent of the problem compared to some of the other communities, you also just have a high number of unsheltered people compared to your population overall. It's a significant amount when looking at some of the other communities that are experiencing this as well. And just to further outline the landscape in general. I mean, homelessness numbers have been going up nationally, so Eugene is not unique in that sense, but from the unsheltered point, you are, and it's a trend that actually is, Oregon is dealing with as a state as well. So there was 4 states listed in this annual homeless assessment report that had over 50% of their homeless population was unsheltered, and Oregon is one of them. So, just want to put that into context. So next up, I think we want to go through the system map that we developed as part of Part of the interviews that we did, we wanted to make sure that we really understood what the different system components you had within your homeless service system and how they interacted and how someone experiencing homelessness has to interact with the system in order to get ultimately to get a resource and to get housed. So if you're looking at the map, we kind of have a start here point. It kind of goes left to right. And you see that there's folks that are at risk of homelessness. So there are probably a lot of people that are living in poverty that might be, behind on their rent. They're close to experiencing homelessness. And then you have, a lot of the population that's either unsheltered or literally homeless. And just looking at the way people move through the system, they would generally start trying to resolve their crisis, their immediate housing crisis, to try to access emergency shelter. And so that's sort of the first place to go. But we found that, just describing what those demographics of the unsheltered population are, there are some significant barriers that those households have that there aren't any emergency shelter beds that are low barrier that these folks would be able to have access to. So, if you are under the influence of drugs, you wouldn't actually have a place to go because there are no low barrier emergency shelter beds. So in that case, someone either remains unsheltered or they might be able to go to one of the alternative to shelter options that you have, such as car camping, the rest stops, the Conestoga huts. But I think one of the key things we want to mention about those, although those are, sort of innovative solutions that are trying to help people that are in these crisis situations, HUD still considers all of those things to be unsheltered. You're not sheltered if you are living in one of those situations, and that's just something that we think is important to note. So you might move into one of those situations. Additionally, you may be getting diverted from emergency shelter if there's that resource. So people that we found that a good majority of folks that access shelter are staying for 7 days or less. So they may not necessarily have needed that resource. So they could have been diverted from the system, but there isn't any diversion services, for example, for single adults. So eventually people make their way, they might be able to get some basic needs met at a day access center. They might have some outreach workers there, but eventually they will make their way to the coordinated entry front door, which is where people are getting assessed for the type of services and housing resources that they need, where ultimately they can get referred to one of the resources that are available within the community. And I think one thing that we wanted to, and there's these different physical access points that people can go to, and there is some mobile outreach to get people assessed for these different housing opportunities. But ultimately, you'll see on the map, a lot of these people just get on a list and then get kicked off after a certain period of time because there aren't really the resources there that are able to turn over. And so 43% of people that have been assessed to date have actually just been removed from the list. So that's sort of a bottleneck that we saw there. And so then eventually you can get assessed, you get put on one of the coordinated entry wait lists, and then you may get referred to one of these different program types. So permanent supportive housing, that's long-term housing assistance connected with services. You might get some rapid rehousing assistance, which is a shorter term intervention that is supposed to quickly connect you to permanent housing. It's housing first oriented, and then there's also transitional housing. So the COC controls all of these resources, and you can get referred through coordinated entry. So that's one way you might be able to access those. There are also some projects that are operating outside of the system that aren't not participating in coordinated entry. And so people just sort of have to naturally find their way to get to those other permanent supportive housing or transitional housing resources. Those are in the corner there of the map. But then ultimately people either stay in one of those programs or projects, housing resources, or they may eventually find their way to other regulated affordable housing or naturally occurring affordable housing in the community, and that's a positive destination. But then another thing that we saw was that even if folks get access to any one of these different opportunities and are in permanent housing, we are seeing still some returns to homelessness, which we'll have some recommendations later on about maybe some of the tenants permanency supports that have to be there. So just looking at those numbers, 19% of people who exited transitional housing to permanent housing actually returned to homelessness within 2 years, and 14% who exited permanent housing returned to homelessness within 2 years.
Great. So I wanted to spend just a quick minute talking a little bit about the challenges that you are facing here. So we were able to look at national, local, and state-by-state census data. And some of the things, when we initially talked about challenges, some of the things I was saying is some things are within your control and some things are outside of your control, right? So we wanted to just point out, Lane County itself, through census data, has a relatively higher poverty rate, a lower employment rate, more seniors live here. There are more people with disabilities under the ages of 65, and and so that really creates a lower per capita income with high housing costs, really creates that perfect storm of less people in poverty being able to afford housing and falling into homelessness. And so we also looked at your rental stock that's currently available in Lane County, and there's a lot of pressure on the rental market, right? The rents are increasing, they're increasing here, they're increasing up and down the West Coast. There's no way to control that. That's very much out of your control. And your vacancy rate is pretty low. It's 6.29%. Nationally, it's about 6.8% if you look at all of them. And on the West Coast, it's about 5.1%. So, you take in rural areas versus cities, so it kind of evens out. But their 2.9% vacancy rate is pretty low. And then we also want to talk about the fact that you have new people coming into your system every month. Right, so you have newly homeless people coming into your system. And when we say, we're gonna talk a little bit more about this, but when we say newly homeless, it could be somebody who's lived in Lane County all their life, and then they've always kind of been living paycheck to paycheck, but finally that landlord raised the rent, and they just can't sustain it anymore, and they fall into homelessness. They could have been a long-term Lane County resident. It could also be people coming from other parts of the state who fall into homelessness here in Lane County or end up in Lane County homeless. So it's a culmination of a bunch of different types of original destination points of folks falling into Lane County. So I just want to make sure that's understood. So, this was a shelter feasibility study. So we want to really point out some of the challenges that that we see with what your current system looks like with the shelter, the permanent. So I'm talking when we talk about this, we really looked at the shelter beds that were permanent and year round, right? So some of the challenges that we saw, or you have, is that newly homeless number of folks who are becoming homeless and are living here, it's 130 a month. So that's a lot of newly homeless people, right? So if there needs to be a system and ways to stop that inflow, or else you're never going to solve the problem. It's just gonna keep happening. As we said a little bit earlier, your shelter. The shelter that is available, the shelter beds that are available year-round, they're not low barrier, so there's a lot of kind of rules and requirements in order to access a shelter bed. So if somebody, as Liz said, is unsheltered homeless, have been homeless for a long time, has a lot of barriers, say has substance use disorder and actively using, they're not able to access that shelter bed, so they're staying on the street and becoming more and more vulnerable. The year-round, in saying this, I don't want to at all discredit or not take value of what the shelter beds that are there. You have over 300 permanent emergency shelter beds currently, and that's a resource. That's a resource that's very important for your community. But you want to work with it. It's a resource that's valuable, but you're going to need a little bit more, and it's going to need to look a little differently, essentially. And then I want to talk quickly about the housing placement and challenges and bottlenecks. So when we talk about affordable housing stock and affordable housing that's available in the community, not all when you say affordable housing, all affordable housing is affordable to somebody that may be homeless, so at 0% of income or even just receiving mainstream benefits. So so you have that overall lack of affordable housing for people who are homeless. The landlord engagement right now, as rents are going up, there needs to be a way to engage landlords to rent to clients to folks who are experiencing homelessness and who do have higher barriers, maybe a criminal background history, previous evictions, that sort of stuff. Okay. So those are kind of your challenges in a very, very broad overview. Now we're going to talk a little bit about the recommendations.
Thank you, Gina. Thank you, everybody, for having us. My name is Doug Tatro. I'm going to go over a couple of preliminary recommendations that will be discussed in much more detail in the report and Q&A as well. And one thing that to highlight, and I think we heard this from Jason and from Liz and Gina, is that even though this is a shelter feasibility study, we realize that building a shelter or dealing with shelter challenges alone are not going to solve the homeless problem here in Lane County. So our recommendations and analysis and discussion is really focused on the system as a whole and how shelters can interact with the system, but also all the other pieces that need to come together. So our overall recommendations are going to follow sort of this continuum, I suppose, of services. So looking at emergency shelter recommendations for current and possible new beds, how outreach might be improved or enhanced, thinking about homelessness diversion, which I'll describe briefly, where the state of your permanent supportive housing units are and where they may be going, how you might leverage rapid rehousing, and then again the tenancy supports, and then connecting this all back to the coordinated entry system, which is really now becoming, under HUD's direction and across the country, sort of the backbone for how you facilitate people from being homeless to not being homeless anymore. So because it is a shelter study, we'll start with that. To Gina's point, there are no low barrier permanent year-round beds for single adults in Lane County that are housing first oriented or low barrier. And by that we mean allowing folks who have, say, behavioral health issues, who may have criminal histories, who may have been disruptive in the past, they are unable to access those shelter beds, and that sort of naturally means that the most vulnerable people who need emergency services the most have the hardest time accessing them and being safe and warm, in an overnight. So we recognize that making sure that we're looking at opportunities to expand that housing first orientation, where housing we're putting the emergency back in emergency shelter, where we're trying to deal with that crisis and move toward the housing solution. We did modeling, which Liz is going to describe, that does recommend an additional 50 to 75 emergency shelter beds in Lane County within the context of these other things that we're going to talk about around housing navigation, housing focused services, low barrier access, diversion, and all of those. Just building that a 50-bed shelter will get 50 of your 1,000 people off the streets, and that's it, right? So it needs to come together as a system in order for it to actually be effective. I just highlighted some of these: immediate access, really housing focus, and as we think about systems, trying to get out of the box of provider A and B and C, and we all do our own little thing, but thinking about where the city and the county and even cross-organizational expertise can co-locate so that you have people who are really good at very specific things, doing those very specific things in partnership with other folks that are doing other things they're really good at. So the emergency service provider may not be the best entity to do the housing search and location and landlord engagement. So how can we work and cross-pollinate that expertise physically and as a community? So consider that. And then we did notice that there's some underutilization of the shelter beds, and I think that goes back to some of the barriers to get in, but making sure that if you have 300 beds or 375 down the road, that every one of those beds is being utilized for those who are unsheltered, and that's an active outreach process and in-reach process as well. So shelter alone won't fix the problem, so I'm going to go over just a couple of the system-wide policy considerations and recommendations that, again, will be greatly expanded upon in the report. First off, outreach. There's limited outreach. There is some, but what we would suggest is that there's a focus on expanding outreach, but also coordinating it, and literally having a map and making sure that folks aren't duplicating their services, that different outreach teams, even for specialized populations that may be looking for very specific types of individuals or families, are communicating with outreach teams for other populations so that everyone is coordinated together, that you don't have parts of your geography or your city or the county that are not covered at all. And so it's an expansion, but it's also a better coordination of those efforts so that everybody's working in unison, even if the end goal means that certain teams and programs need to target different types of individuals on the back end. The other one is homelessness diversion. This is an emerging practice across the country. If you are able to work on this, I think you'd have a good chance of being a leader in it. But what we've realized is, to Liz's point about 7 days or less, many folks do self-resolve or only experience homelessness for a short period of time. And what we're seeing in some select cities across the country is efforts to immediately engage with people who are presenting for shelter or crisis services to find alternative, even if temporary options for them other than being in a homeless service bed have been successful. There's some cities right now that have been able to divert between 10 and 18% of folks who present. They say, I have nowhere to go tonight. And they have a conversation with somebody who's trained in mediation and conflict resolution, and they're able to get back to mom's house. Or maybe they're from another part of the country and there's a limited fund available to get them a bus ticket and connect them with the services there based on their choice and desire. So that diversion effort, the training that's related to that, would be at the front door of all of these access points, are certainly the largest ones. And then rapid rehousing, expansion, and better utilization. One thing we've discovered with rapid rehousing, which is a short to medium term intervention, rental assistance with services, is that it's a really difficult project to run really well. And so to be thinking about who in the community should be running those projects and can have that deep expertise in the housing navigation, crisis response. Is there a way to, folks may have heard of a by name list in the veteran space has been a big discussion where we know every veteran. Can we think about by name lists as related to landlord recruitment and managing your housing partners so you understand different risk aversion and things like that? But rapid rehousing provides a lot of opportunity if it's done really well. And we've discovered that there's very little prediction that says somebody must have PSH, otherwise they won't be successful. We see very high success rates in rapid rehousing when the services are done correctly, and we look at a 4-dimensional tenancy support model, which looks at how we wrap services in a progressive model around folks, and that requires training. It also requires orientation of your projects. And when you have a rapid rehousing provider, they are not just serving the folks that walk in their door. They are co-located at the shelter. They are working with outreach. They are working hand in hand with coordinated entry staff who are making referrals so that those resources are spread across the provider network, and it's not just isolated to whoever happens to be served by that organization. So those are some of them, and then Gina's going to talk about some of the other policies.
So in addition to what Doug just described, we would also recommend increasing your supportive housing stock and the utilization of your current supportive housing, permanent supportive housing portfolio. And when we say increasing your stock, so you'll see in a second when Liz does the modeling, we're going to suggest 350 new permanent supportive housing units. That doesn't mean you're building 350 new permanent housing units. It is, it's taking what you have, maybe using it a different way, maybe creating preferences for people who are homeless so that they would jump on the top of the list or a wait list. It would be using practices like or instilling a move-on policy or move-on practice where folks who are in these really rich intensive services for permanent supportive housing, once they are stabilized and don't need the really rich intensive supportive housing model, they can move on to other kinds of affordable housing, and then somebody who is very vulnerable and unsheltered could move into that very intensive. So I'm kind of looking at your current portfolio, getting some units for that will be prioritized, as well as creating some new units. And tenancy support. So Doug touched on it. You know, it's a theme. It's a theme that really needs to be within your system. When we looked at the system map, about 19% of the people were falling back into homelessness. So those were folks that were housed that are coming back into homelessness. So even if you just shave off that 19 number through stabilization, tenancy supports, client choice, working with the clients where they're at, all that will help that number as well. And then we talked a little bit about the coordinated entry system, but that's really the way to for someone to access your resources in a coordinated way. It's not siloed from program to program or agency to agency, essentially. So the very last part, we're going to spend a minute on some system modeling and talk a little bit about what.
Okay, so we just we wanted to make sure we had a sense of what the numbers are of the resources you have available, how they're actually getting utilized, what the turnover rate is. And so this first slide here actually is just a capture of what your current system looks like, showing the number of beds in emergency shelter, transitional housing, rapid rehousing, and permanent supportive housing that are for single adults. And if you just look at the utilization rate and the turnover rate, can kind of give you some context for why, there is such an issue right now with the number of unsheltered. So they're not all interventions are being fully utilized. Like rapid rehousing, for example, is at 73%. And I think in the report we're going to go into why we think that is. But then the turnover rates are also pretty low. So if you are, if you're looking, if you are in need of a permanent supportive housing unit, it's only right now 2% of the portfolio is turning over. So again, that's a major bottleneck in the system for allowing for that flow. And so what we did is we took a look at your current numbers and the number of folks that are in these different emergency shelter, transitional housing, and how many are unsheltered, and considered the amount of newly homeless people that are coming to the system to get an idea of what would happen with these different recommendations that we have. So if you were to add, 50 to 75 low barrier emergency shelter beds. So with that number now, it actually increased to about 439 total for single adults. You'll see that in the lower portion of the chart, you'll see that the unsheltered number does go down. It goes down to 977 if you're looking at a 12-month time frame. But the total literally homeless is actually still going up because, again, you do have that number of people that are newly coming into the system. And so that's when we're saying shelter alone is really not going to solve this issue. So you have to really look at it from a system perspective. And so when we do that and we add in all of the different recommendations that we're going to be outlining in the report, including the emergency, low barrier emergency beds, increasing utilization across interventions, increasing turnover across interventions, increasing diversion, so diverting more people from actually coming into the system, and then adding 350 units of permanent supportive housing in whatever way that makes sense. You see that within a 3-year time frame, you actually would, basically resolve the issue of unsheltered homeless population. You would still have, because of just the extent of the issue, you would still have a lot of people that were still literally homeless, but the need for permanent housing will have gone way down. So that's when all of these factors are combined. If you're able to implement that as a system, you really can see what the potential results are. So this is just kind of a visual of that. The number as these different utilization, turnover, all of that go up. The number of homeless go down. And just as a follow-up, as far as coming attractions go, this is just the interim sort of preliminary recommendations. We will be producing a final report that will include budget estimates for what we think the need is for these different types of expansion on these different program types, best practices to incorporate as part of those, and effective ways to implement these recommendations.
Commissioner wants to go first.
Okay. I have a city councilor who'd like to go first. Councilor Sayret.
Thank you. Well, thank you very much for this preliminary report. I just want to note I've served on our Human Services Commission for over 10 years now, first as a budget committee member and now as a city councilor. And I am going to actually take some credit for getting us to this place today because I pushed for our council budget resolution to set aside $1 million as a down payment on a shelter, knowing that there are a myriad of other needs in our system, but recognizing that this was a critical piece that was missing and therefore moving us towards creating more capacity to engage in housing first. My goal with that budget committee motion was to get a low barrier publicly funded shelter built, recognizing that this is only one gap in our system. So I'm very grateful to finally be at this point to receive this preliminary report that's moving us closer to that goal. You know, you point out that we have many more dynamics here in greater quantity than some other communities. That is helping create this housing crisis. We have more senior citizens, more vets, more people with disabilities, lower wages, a very low vacancy rate in rental housing, all which makes tackling this problem much more challenging than it might be in other communities. To some of the things in your report, you have a recommendation around expanding street outreach. I absolutely agree that that is a gap in our system, and I really appreciate the way you're framing looking at that work and in general looking at the work from who does it best and who should be doing it. I do have a couple of questions. Your report in the body said 21% return to homelessness. On the map, it was 19, but I'm also curious how we compare to other communities. And I will take a second round if I'm able.
Okay, great. Councilor Zelenka.
Can they answer my question?
Oh, sorry. Apologize.
So on the 21%, so that is when you combine those two. So the way these HUD system performance measures look at it, they combine those that are exiting these different interventions, and the map is calling out separately those interventions.
Thank you.
Got it. Okay, now, Councilor Zelenka.
Yeah, thank you for all this work that we're still doing, but thank you for getting us this far. I like the housing first orientation, the rapid rehousing, the move on strategy. All that seems to make a lot of sense to me. I did have a question about the graph about homelessness, the PIT count, the point in time count. 2011 to 2016 saw a dramatic drop, but then we're starting to see an increase, not dramatic, it's about 13% over the last 3 years, 190 people. If you could address why that's so, as well as 130 new homeless people entering the system or being in Lane County, that's just the people entering the system. It's not net people leaving the systems. Otherwise, we would have twice as many people homeless in a year. So maybe you can talk to that as well. What's going on?
Sure. So I think I would have to defer the why that it was higher in Lane County starting in 2011. I think we've had a couple of conversations about why that might be. Part of it's the data collection methodology changes over time. So in a lot of ways, and you'll see this in other continuums of care, like the numbers are showing increases, but it actually is a reflection of them having better data collection methods and doing better outreach during the point in time. So that could be a reason, but I just don't want to speak to what some of the other reasons might have been back in 2011 that we didn't really do that kind of data analysis on.
My question is more about the last 3 years. Why is it going up?
I mean, I think because of that, those newly homeless, and the newly homeless that, again, if people keep coming in, they're not exiting. As far as not accounting for exiting in the modeling, we do account for a number of people that would be self-resolving because we do know that nationally there is a statistic, is it 30%?
Yeah, so depending where you are, 20 to 30% of folks will self-resolve their homelessness, within 7 to 14 days. So the number of people who become homeless nationally in a given year is far fewer than those who stay homeless in a given year. So we account for that, as well as the turnover within the projects you have right now in the modeling. But I think it's worth acknowledging, though, that the increase, I mean, you all know, and I think everyone across the country, and certainly the West Coast knows, that the tremendous pressure on the housing market and the rental market right now. So, we didn't do that analysis of your rental market in the last 5 years, but I'd be hard-pressed to believe that that's not a factor in seeing some of these numbers. Right, exactly. And we're seeing that everywhere. Yeah.
Right. I was just in the Bay Area, and the East Bay paper, the front page of it had 2 articles just to show we're not alone. On the right side, it was about renters revolting the higher rents. On the other side, it was about homeless camps. Right. So every place I go, it's the same issues over and over again. Another question on slide 7, you had the mental illness and substance abuse. So that's 38% of unsheltered people have mental illness and 30% have substance abuse issues. Can you add those together and say 68% of homeless people or 2/3? How do you do that? Or those?
Well, no, because those can overlap. Yeah, so good question. Yeah, so someone could, and it's likely that a lot of these people are chronically homeless and then do also have a serious mental illness.
And it is self-report, to be clear. And then the chronically homeless number means they must also have a disability that may or may not be on this list, but it could be a physical disability or something else.
Yeah. Your system modeling is really interesting to me. It really shows that there's no silver bullet, like a shelter. won't go there, Mike. But there's many different things that you're recommending. In fact, just by adding the shelter, actually the homeless people go up if you just did that. In coordination with all the other things that we would do, you actually see a dramatic drop. So I think the key takeaway is just just new beds isn't a silver bullet, but adding all this and making it a system and doing all of these things together, you have to do all of them together in order to get that. If we just do a shelter, we're not going to do anything. In fact, it's going to go up.
It'll continue that trend.
Says.
Yeah.
Okay. I'll need it round two.
Commissioner Farr.
Thank you, Mr. Chair. Doug and Lisa and Liz, thank you very much. And thank you for the October 4th presentation that you gave over the telephone. A number of us were able to see some of these numbers initially and generate some questions at that point in time. But the thing I'm going to say is, in a 90-minute meeting, there are so many rabbit holes, and we used that expression last week. There's so many rabbit holes that we could chase down, that so we don't want to get bogged down in specific questions. And I'm not going to bog you down with specific questions, just talk about a generality. And I like to address my comments to Mr. Mokrahajski, because in our board meetings, he's right in front of me usually. So what we need to focus on is the fact that we are all in this together. As Jason Dedrick said, the study was initiated as a partnership between Lane County and the city of Eugene. Sometimes we forget that there's a partnership involved in this, and sometimes we forget that that we are in the journey together, and that we are working together on many issues. A lot of the things that you talk about and the things that you point out are things that we have some form of structure surrounding already. We all know that, and we've discussed that. So it's a matter of us making certain that as we listen to your presentation today, and as we go down to the next exciting steps, the follow-up steps, that we are together in this, and that we work together very, very closely, because you stated that, let's see, you want to consult, let's see, and get our, I don't have the exact quote right here, no, here it is. That you want to consolidate our resources to make sure that people with expertise are doing the things that they have expertise surrounding. And Doug, you said that in your presentation. It's important to know that as I look around this room is completely packed with people who have been working on this for years and years and years and years, and that this study is a way to gather things together and to help us to all realize that we have a common mission, we have a common strategy, and while shelter is one thing that we're addressing right now, Doug, as you said, the system-wide analysis is the most important part of it. And I'm looking at the names right now, so. Thank you. Thank you for pointing that out. I'm through.
He's done. Councilor Clark.
Thank you, Mayor. I want to say thank you, first of all, to all the county commissioners who are here at the table with us. I know that there has been years and years and years of ongoing work and coordination with so many folks and so many agencies, and with the county and the city on this issue, but we don't get together frequently, the city council and the county commissioners, to talk about this at a policy level and say, we want to make a holistic dent in this, and we want to have some success. And so I appreciate that effort. I hope we do it more frequently, to the degree that that's helpful. I appreciate the report very much. There's a couple of things here that occur to me as questions, and I too want to keep this more general than, get too specific down any particular rabbit hole. One of them is that it seems to me there's an awful lot of focus here on the system itself that responds to people who are in this condition, okay, who are in the state of homelessness. And how we create a system where people flow through it. But I wonder if we wouldn't benefit from more analysis about the differences in the type of and the challenges of, although I grant there's some, but the differences and the challenges of the people flowing through the system. And by that I mean, for example, you talked about the lack of wet beds and the those who remain unsheltered because of substance abuse problems or what have you, they're not, that's a barrier to entry for them, right? So my first question is, are there other barriers to entry other than that we're not recognizing, bringing up, and having as discussion? So as the experts here, I would ask that. A lot of times, in this particular case, we're saying, you know, the rule is get dry, get clean, and you can come sleep here. And somebody says, well, I don't want to. So what else might they say, I don't want to, with regard to rules?
So the question is, so folks that may have maybe resistant to the services that are being offered to them, or who may not want to play by the rules.
To the rules for compliance.
Right. So one, I think breaking down the barriers of compliance, right, and finding ways that we can offer services that they want. And we want to make our service package, whatever that is for that individual, desirable, right? And so folks who are actively using. Now, there obviously needs to be a health and safety check in terms of what comes into a facility or into a shelter space. But those are the folks that I would argue in an expanded outreach model and a model where you do have shelter beds that are lower barrier, those are the folks that your active outreach is trying to bring in because they've likely been turned away from other beds in the past. So there will be folks that no matter how low barrier a setting is, they may not want to do that, and they may remain outside. I think then it becomes an ongoing active engagement discussion where folks are, there's not a precondition to entering shelter in order to also be prioritized for a permanent housing opportunity. So I don't know if that answers the question, but I think we as systems need to make our services more desirable for the people who need them most. And even when they don't want those services, our job is to continually try to engage. And maybe that's setting up peer outreach models so that a veteran can have a conversation with another veteran, or a victim of domestic violence can have a conversation with somebody with shared history, so that there's a comfort level in trying to engage in that. But I think that the last thing that we would want to see happen is somebody says, I don't want to come in, I don't want to talk to you. That is more reason to be back there 2 days later trying to have another conversation in a different light.
Yeah, I appreciate that. Have we got time? All right, another round, please, Mayor. Thank you.
Councilor Taylor.
I'll use the rest of Mike's time. This was very interesting. I think that the coordination is really important. And I don't know whether you observed whether we're doing that or not, but I was on the Human Services Commission, and I felt there was a lot of duplication that was unnecessary, and that there should be some central place where people know who's doing what. And is that something that you investigated or noticed?
Yeah, I mean, I think that just based off of a lot of the stakeholder interviews and seeing the way that the coordinated entry is set up, that there is duplication of services in different places, and that where there is some coordination, but it's more pockets, and it's not necessarily system-wide, which again, in the final report, we'll get into some very specific recommendations around, how we think what direction you could move in and around that. And landlord engagement was another one that came up as far as having more of a system-wide engagement as opposed to individual sort of programs being able to do that.
Thank you. And I think the turnover is really important. Did you talk to sponsors?
We talked to providers, right, that are actually administering the
Sponsors that deals with people who've come.
Oh, I'm sorry. No, I don't think so.
I think they are really good at turnover, at helping people temporarily, and the turnover, finding another place for them to be.
Okay.
I think we could learn a lot from them. Prevention is, you mentioned diversion, that's good too. Did you talk about prevention of homelessness?
So there isn't a lot of prevention, particularly for individuals in Lane County, if any. There's a veteran prevention program called SSVF, Supportive Service for Veteran Families. So we didn't dig in too much to prevention. It will be part, I think, of recommendations around making where you do have prevention resources, which are fairly finite, even through HUD and some of the federal partners, how to target that. What we know about prevention is we often are preventing evictions, but not homelessness across the country. And there are very specific and nuanced ways to target prevention resources to make sure that the folks who receive that dollar are actually going to become homeless and not just uncomfortable in an unstable housing
situation. If the roof is leaking and the house is being ruined, there are things, loans, interest-free loans perhaps, or even grants. I know some cities do. I think Little Rock does a lot of that. And utility bills. I think if we looked at all the things that may cause people to become homeless, illness, utility bills, house falling apart, or the things of that sort. And I wondered if you looked at things like that.
We didn't look at it specifically within the data of Lane County, but the targeting recommendations around how to target prevention would address specifically those types of risk factors. And where there are, again, it's very limited, but where there are prevention resources, how to make sure that, to your point, that the folks that need it are going to become homeless because their utilities are so backed up they need to leave, or their house has now been in disrepair and is uninhabitable, and they don't have a safety net to move somewhere else, and how we can target that. And there will be recommendations on that.
Okay, thank you. And I'm disappointed we haven't done anything yet about the money we set aside for shelter, but I hope that we will start to do that. I don't see the city manager here. We're working on it, but it's getting cold pretty soon. Thank you.
I wanted to follow up real quickly with Councilor Taylor's question about sponsors. TAC did speak with representatives from sponsors. I think they have spoken to so many entities that they aren't keeping encyclopedic knowledge.
Got them mixed up there, yeah.
But they did speak with them and get an opportunity to learn more about how their services work and how it contributes to the overall system. So just wanted to clarify that.
Oh, thank you.
Thank you.
Commissioner Sorensen.
Thank you very much. Well, I'd like to thank the people from TAC for coming and making this presentation today, but also later on to the community. By way of introduction, I'm the county commissioner that represents 70,000 people all within the city of Eugene. So I'm the represent about half the city in my commissioner district. And I just appreciate the opportunity to talk. And I think Commissioner Williams has a chunk of the Churchill area as well. So, you know, I really appreciate what you're trying to do here in terms of quantifying this, giving us some good data to work with. But I would like to suggest that the 3 minutes that I'm given, or 2 minutes, I was promised 3, just for the record, that maybe you could give me a written response to this, because I don't have time to ask all these questions and get answers in 2 minutes. So I'll just say, first of all, thank you. And secondly, I feel like we need to do a better job of coping with the inhumane problem of homelessness in this community. We need to be very clear that it is inhumane, and it should be a goal of our community to have no homeless people. At the end of this process, whatever it is, it shouldn't be, oh, well, we're going to have some homeless people. I believe that our goal should be no homeless people, and if we have to make the goal 48 months, it should be 0. So I don't like the idea that at the end of this, we're going to have homeless people. I want the goal to be no homeless people. I think that the reason we're here is because our excellent nonprofit groups are overburdened. They are collapsing with the demand, and it is government, city and county. They need to step up to doing something about this problem that has not, at least heretofore, been solved, despite great efforts. I also feel that the work you're doing is good, but it needs more data. And by data, I mean, how much is this going to cost? When you say we need to have this many beds, how much is that going to cost? When you say we need to have coordination and we're going to have veterans talking with veterans, well, we have a Lane County Veteran Service Office. Is that part of this? Where's this money going to come from? And last but not least, I'll say besides the critique of specific projects, because you did recommend a specific project with a specific number of beds, besides the fact that we don't have a cost number on that, and again, it's not everybody's job to do all these things immediately, but we need to know how much that's going to cost, and we need to know how much the other softer things are going to cost to have more of this coordination. And last but not least, we are not experts on the current methodology of getting this money. Once we figure out how much money it is, what resources that we're not aware of, that you might be aware of from your lofty perch of looking at the whole country and looking at the different communities you've worked with, what other opportunities are there for us to get the money to do this? Because without the money, we're not going to do any of this stuff. And I'd just like to get down to the brass tacks as soon as possible. And I really appreciate your leadership, and thank you for listening. Thank you.
Can we briefly respond? I know. Okay.
Oh, and I emailed this to Jason so he can get this.
Okay, so I just want to point out that we're definitely going to do cost estimates and a layout of what the recommendations will cost in the report. We're just not there yet. But that'll definitely be what it would look like if you added 5 full-time employees to an outreach program throughout your system that floated through. It would be X amount of dollars, and it would have ultimately this result in the modeling system of that. So yes, definitely.
And I'll add those recommendations and that discussion of costs will also include discussion of current positions, current dollars that can be reoriented without adding. So there's obviously a cost to all of this, but there's also efficiencies that we might suggest that don't require another line item, but require a different job description or different type of orientation to somebody's work. And those will both work together in the report.
Yeah, and I'll just say, I think the goal, you're right, the goal at the end of all of this really is that no person is experiencing homelessness. So we might take that into account as part of the modeling later on. We might do further out timeframes around that.
Councilor Pryor.
Thank you. Really great for a preliminary report, and so I appreciate we're responding to just the bare bones, so I'll look forward to that. Things that strike me in this that I really will be looking forward to in the final report is just as housing follows a continuum from tents to McMansions and all the things in between, there's also a continuum of homelessness, and no single strategy will be able to address all of the different variations and types and combinations of homeless people, and the balances of their condition versus their behavior and what that might require in terms of response. And so I very much hear you say that you can't build your way out of this with just providing more beds, because that won't deal with many of the people on the continuum of homelessness. So for me, what I'll be very interested in hearing in terms of both the strategy and the costs and the implications are the human side of what our response will need to be. When you talk about supportive housing, one of the words in that is supportive. When you talk about housing first, one of the elements of that is the support that you provide. So there is going to be a human element, and that involves money. One of the difficulties in our conversation now about a low barrier shelter is we have the money to build the shelter, but we need to develop the funds to pay for the human side, the operation and the support services and everything else. I'm really looking forward to this report to provide some help strategically in terms of how we might address the human side of this and the cost of the human side of this, because, as was mentioned before, our human service system and all of the great people in it is stretched to the limit right now. And to be able to have those folks absorb any additional churn is going to be very challenging. And so what can the strategies be for us to support that system, the human side in addition to the building side? I think it's only going to be the combination of the two that really is going to allow us to be successful.
Yeah, I would actually argue the human side is more important than the building side. And a number of the things that we outlined very quickly on our slides speak directly to that. So, and will be in more detail around training related things. We talk about 4-dimensional service planning, which is an orientation for how to consider different service packages and needs based on individual client and household needs. And then obviously, how do people get their jobs done in the 40-hour week. And so I think many of these recommendations focus specifically on the people, the hardworking people in this room and out there that are doing the work and how they can absorb this type of activity and at what cost. But oftentimes I think we know that it's the case managers and the housing navigators that rule the world, and they're the ones who really get things done. And we'll be talking a lot about that.
I have 3 counselors waiting for a second round, but are there any of the counselors who haven't spoken? Any questions? No. Okay. Counselor Surratt?
Thank you. The 2-minute time frame is hard for all of us. So I am looking forward to more in depth around the coordinated single entry, because I was under the impression we had that here, but you're saying it's kind of limited navigation is the term you attach to that. So I'll be interested in seeing more about that, as well as your estimate that that we could, by using 2 to 5% of existing affordable housing options, increase to 200 move-on units where folks can be temporarily until they can move on to somewhere else. So I'm interested in hearing more about that. I'm curious, under the map here, the mobile outreach, you list shelter care, and curious if you spoke with Whitebird and understand how Cahoot's crisis service works, and if they weren't included because they don't provide housing.
We spoke with them, yeah. We spoke with them a couple times, actually, in interviews. We spoke with Whitebird, and then we also spent quite some time talking about the Cahoot's van and the crisis response and how that works.
You have an understanding of their role?
Mm-hmm.
Okay.
Yeah.
Yeah, so when we're talking about the move-on units, I think we want to be clear on what we mean by that. So that is a strategy that we're highlighting that will ultimately increase the turnover in some of the other permanent supportive housing resources that are there, so that someone that might not need necessarily the type of services that are offered, and has been, I think if you look at some of your lengths of time that people are in programs, and some people need that for forever, but other folks, they might be able to move beyond that and move just to where they need the housing assistance piece and not necessarily the services. And those are those move-on strategies that we're talking about. So maybe they'd be able to access some of the other existing regulated affordable housing that's out there through this move-on strategy. So that's what we mean there. And as far as the coordinated entry, so Whitebird is not currently doing
No, I wasn't
assessments.
conflating those two things.
Okay.
Those are separate
So yeah, we do have some specific, we'll have specific recommendations around coordinated entry. One of the things that we have, highlighted in our discussions is that it's really great that you guys got coordinated entry off the ground at an earlier point than a lot of other continuums of care across the country. But since that point in time, there have been, some newer practices that HUD is highlighting, that other communities are doing, that we think are really great things to incorporate into your coordinated entry, and that's what we'll be highlighting in the report.
Great, thanks. And then just a couple more things. So in terms of compliance barriers to actually accessing services, I have heard that people who have pets or couples who are told they cannot stay together at the mission, that is a barrier. And also I know that there are many people who find the environment at the mission to trigger their PTSD or other anxieties, and it makes it very difficult for them to stay there, even if they want to. And so that brings me, I was very interested in this headline in the paper earlier this week that Peace Health is planning to turn a residential facility they have into a crisis facility for mental health care treatment. Today we're talking about public shelter, but this gap in our mental health services is a tragedy that we have on our streets. We have a shortage of short-term facilities, a real problem with the system that provides for civil commitments for people who would qualify, and we have extremely vulnerable people living on the streets and being victimized every single day. And we saw in your report that almost at least 39% have self-reported that they live with a serious mental health issue. So I think we're gonna have to think about that as well as we are going down this path. So I really look forward to your final report, and thank you for your presentation today.
Commissioner Williams, did you want to turn in the queue?
Yeah,
or I put myself in.
A couple things occur to me is that when we talk about housing shortage, housing stock, unsheltered, The one thing that has not been addressed is the need for buildable lands, zoning and permitting process thoroughly examined to find where we have encumbrances to development. So with that, I believe some incentives should be looked at as well for those folks that are investing in housing, the builders especially. There's got to be a profit incentive for people to build. And when there are barriers, excuse me, to that, therein lies a great piece of the problem. Thank you.
Councilor Zelenka.
Yeah, I echo the mental health comments that Claire, our system is appalling. I want to get back at slides 22, 23, and 24, the modeling. Let's see if I understand this correctly. On slide 22, you modeled building a shelter for 50 to 75 beds, and the result was, at the end of a year, you actually have more homelessness, less unsheltered people. Then you added in the other four things: increased utilization, turnover, access across the interventions, increased diversion, and adding more supportive housing, and it drops dramatically. And so I'm kind of wondering, is the shelter a necessary but insufficient thing to do? Why is it in the recommendation if it doesn't accomplish what we're trying to accomplish, which is less homeless people? And I'm also interested in bang for the buck on these different things. So when you come back with the full report and the analysis you're doing, is there a cost effectiveness metric that you're doing, like dollars per homeless person reduced, and how, so we can look at our spending about where it makes the most sense?
Yeah, well, I mean, so there's a couple of different cost considerations that you're asking. I'll turn you back to the first question. On the bang for the buck, I think this specific project will talk about the most efficient responses. So we know that a rapid rehousing intervention is far less expensive than a permanent supportive housing intervention. That's not to discredit PSH, it's to acknowledge that we need to make sure that, frankly, the PSH is going to those folks that are in the streets right now that are in mental health crisis and that need that the most, and that other households are receiving less expensive interventions. We'll also talk about progressive assistance, where we start with a lighter package and we scale it up as needed and only when needed, so that we're not throwing everything at everybody. As far as the offset of, of the cost of homelessness versus not being homeless anymore, that's not something that our analysis will get into, but there are studies in similar sized cities that demonstrate significant public savings for those folks who are high-end utilizers of emergency services, medical systems, jails, detox, those types of systems, comparing their costs in that space to the cost of subsidized housing with services, and actually seeing a cost savings, which is more of an opportunity cost, harder to find on the balance sheet, but there are some studies that have addressed that very specifically that we're happy to reference as well. We won't be digging into your Medicaid system here for that, but that data is out there.
That's the next iteration. What about the modeling?
Yeah,
Sure. I mean, I think as far as the modeling goes, just based off the different interviews that we have and looking at the data, at the end of the day, you don't have a place for someone to go that does have these high barriers. And so by not having that resource, you're basically saying these people are going to be staying in these unsheltered locations. And from our perspective, that's not necessarily an appropriate response. But ultimately, if you were to add shelter, we know that that wouldn't solve the number of people that are homeless, but it would be giving access to, a safe place for a night. And that over time, you will still need to have, people are always going to be experiencing homelessness. If you talk about some of the other initiatives out there around functional zero, there's still going to be people homeless. It's about being able for your system to have system capacity to be able to intervene as part of a crisis response, and then be able to place into a more permanent housing opportunity. And so I think when you're looking out through that longer time frame, it's still going to be important that you have those shelter beds there.
Yeah, so as Councilor Sarah is saying, the low barrier part that we're missing in our care. So I know you can do a budget and a timeline, which would be a capital budget, but I'd also like to see a sustainable budget over time, say over a 5-year period that says this is how we're going to do this, how we're going to fund these things, what it would cost to do that over time, not only shelter, but also the programs.
Operational costs as well as,
Yeah, over time, right, so it's a sustainable thing. The other thing I'd like to see in the
Can I add something to that over time budget conversation, or sort of the efficiency of the resources? One thing that we didn't really highlight clearly here, but would be part of the discussion in the report, is as you solve the problem for the most vulnerable, solving it for everyone else becomes cheaper. So you have a backlog of folks that are highly vulnerable, who have high-end needs, who need this longer-term service intervention. We're talking about targeting that group and that being the laser-focused priority, because as you're able to resolve the homelessness of those folks, the folks that then are flowing in can be responded to more quickly. So there's the budget on the shelter side and the operational piece, but there's also the reality that your resources go much further over time as the highest end utilizers are accessing housing stably, and then folks don't need as much. So there's even that shift of, do all the shelter beds stay that, or does it become even a housing navigation center over time, because you don't need all those, and I mean those are down the road and it's hard to model that, but it's just an important consideration.
Yeah, finally, looking on this for 30 years with Steve Minot and Susan Van, we're starting the Safe and Sound project, keeping doing this. So that felt like what we're doing was not keeping it from getting a lot worse. This feels really fundamentally different to me in that it has the analysis, the systems look, the focus, and the coordination of all these multiple recommendations. So this really does feel different. It's not the same old stuff. I think this actually will move the dial.
Councilor Clark.
Thank you, Mayor. I'm with Commissioner Sorensen. I understand that getting to the number of 0 homeless people is probably not going to happen. But I want to see us make a significant dent if we're going to step up the kind of resources it seems we're talking about. And I appreciate Claire giving better vocabulary to the things I was talking about earlier about barriers to entry. There are lots of different rules around that I think we need to talk about. And for me, it is that human part that's more important for us to focus on, where the gaps exist, that people fall off of the road to a healthier world, to being sheltered. But it's also the entry point that's interesting to me. You said 130, and so there's a pretty constant argument amongst different people in our community, not just at this table, about whether or not people come into our community, or whether the homeless population we have are all from here. Okay, and I don't want to get too bogged down in that, but I wonder if you might address, first of all, did you do any part of this study to be able to speak intelligently about how many people come here for immediately or a short period of time, or how long they're here before running into that issue, number one? And number two, address the issue of, as you rise your capacity to successfully serve people in need, does that become, in your national experience, does that become a draw from without the community to other places in Oregon, like Portland, that you've mentioned has a gigantic problem? Could you address both those things, please?
So I think, unfortunately, and I think this is the million-dollar question that every community would want to see, is why are people coming into my system and where are they coming from? We don't know. We don't have the data on it. There's a lot of anecdotal reasons why that happens. I think different parts of the country have different reasons. Your weather is fairly temperate all year round for the most part. You're not in Boston. It doesn't snow. It's not negative 20 degrees a couple days a year. I think around the country, the number of homelessness, especially on the West Coast, as we talked about, is going up. I think that Portland's seeing a rise of number. You're seeing a rise of number. So folks may go from the I-5 corridor. They may come to your community where they didn't grow up, but folks from Eugene may be going to Portland there. So the numbers are pretty consistent of inflow around the West Coast, pretty equal. So I don't think, it doesn't look like everybody's coming here and all the other communities are sending folks who are experiencing homelessness to Eugene. It looks like folks are floating throughout. But we don't know. Nobody knows the reason.
Yeah, And in our experience, creating a better homeless crisis response system that focuses on housing generally does not attract greater numbers of people, certainly not from far distances. There may be folks that are, so as many folks as may come to Eugene, there may be as many leaving Eugene to go to Portland too. And so there is that transient nature of any homeless population. And I think it's consistent across the country that everybody wants to know who's from here, right? But we haven't seen places that really did a good job and then all of a sudden had this influx of folks that were looking for services. There's certainly weather patterns, right? So Florida becomes a hot spot in the winter and things like that where people move, but we haven't seen that. I think to the point though of understanding who's here and or who's from here and what that presents as an opportunity for reconnecting them to housing is going back to that diversion discussion that we mentioned earlier. Homelessness diversion is really about having a conversation with everybody presenting for services and trying to identify the best pathway out of homelessness or to avoid it. And those are the conversations that I think, when done well, identify folks who are from another area who thought they could find work here, were unable to do so, or whatever the case may be, and reconnecting them either to their community of origin or with resources locally. So the data, there's no data set that tells anybody in the country where everybody came from, or at least not reliably, but there are practices that I think can get to that and can start to mitigate the effect of folks that may come here looking for opportunity that doesn't exist and giving them a pathway back to their community of origin.
Thank you.
So I want to thank you for the report, and I really like the system analysis part of it. I also sit on the Human Services Commission, not as long as Claire, but I also sit on the Public Safety Coordinating Council. And watching a system work as a unit is really important in coordinating those efforts. We've done great work in restorative justice here in Lane County, which is part of a homelessness prevention strategy when it gets right down to it. You know, as I look at the modeling, as we get down to zero unsheltered, for me, that's really important as we look at the Ninth Circuit Court's decision about criminalizing homelessness and our ability to deal with, you know, downtown and behavioral issues and all that if we don't have some place for folks to go. So that temporary low barrier shelter is a really important piece of getting to zero unsheltered. So, you know, it may not move the needle by itself, but with all the other strategies, I think it's really important for us about treating people properly with their civil rights. So if we don't have that low barrier shelter, we can't do that. So I think that's a really important piece to recognize. But I think it's really important recognition of that, you know, trying to work coordinated. I really appreciate the focus on geographic and demographic coordination so we're not repeating efforts, particularly seeing I represent a lot of the rural Lane County all the way out to Florence, so want to make sure we're spreading that effort correctly. But I really think that that system approach is really important. And I want to, you know, thank Ken Beeson, who was a former member of HSC and was our chair, kind of brought us back from the edge of splitting up a little bit. There was a while there where we were starting to divide efforts, and he kind of got us focused back on focusing on the Human Services Commission as a system that we all contribute to. So just want to take a moment to thank Ken for that.
Councilor Taylor.
Thank you. I wondered if you looked at or thought about single room occupancy as a partial solution.
I think as part of the recommendations, there needs to be creativity in the types of housing that people can access, including where SROs or efficiency units are more appropriate, whether built or found. I think there's also a reality that often gets folks a little hung up, but it's a strategy, particularly in high-cost markets, is shared housing, which is really just called roommates. I have one. She happens to be my wife, but I have one. Many people can't afford to live on their own in this housing market, and there are key strategies on how to match people so that there's an appropriate fit, so that we're not creating problems in units, and how to support that. So I think there's a whole variety of different housing types and links that we need to be thinking about, other than and knowing and letting folks know that this may be your permanent housing, but it doesn't mean it's the only place you'll ever be able to live. And maybe there's a roommate situation for a period of time, and that gives you an opportunity to move on to your own place later. But I think we need to look at all of those different types of arrangements.
But even just single bare rooms would be good for temporary housing for And I remember when they're, in any city, you could go get a room. And I don't think we have those anymore. Boarding houses too. Roommates are fine if you can get along with people, or if you find someone who wants to marry you.
Are you talking about like a temporary shelter or permanent housing?
I'm talking about, it would be whichever it needed to be. I'm talking about being able to rent a room.
Yeah.
And if we are helping support or subsidizing or giving tax-free housing, I think it would be a good investment for us to help building of single-room occupancy buildings, so that someone could rent a room for a lot less money than, and it would probably be temporary if they could afford to move on, but it could be permanent either way.
There are cities that do that have whole buildings or developments that are SRO with shared kitchen and living spaces, and they have leases.
You don't even have to have a kitchen. It's still better than being out in the mud. If you just have a place for a bed and a bathroom down the hall. I don't know if you thought about I agree with Councilor Clark on some things, and I think.
I haven't recovered from the last thing you said.
Well, I think that people do move around where there are, and I think that we need state involvement as well. It should be federal too, but we need not just local governments subsidizing or paying for things. It's good that the county and the city are cooperating, but we need something bigger than that. Thank you.
Thank you. I'm just going to dive in for one last very basic question to you, which is, we asked you to do a feasibility study on a shelter, and you came up with a number of 50 to 75 beds, and could you clarify for us why?
Well, I think Doug has already talked a little bit about this already, but ultimately when we're talking about all the different things that you need to do in addition to the shelter.
I'm thinking about the number, not the
right,
reason.
just that eventually your system will not need, so right now you have over 1,000 people that are unsheltered, single adults. You will not need 1,000 beds when you're looking at over time. That doesn't actually make sense, because the idea is with all these other recommendations, you'll have a system that can respond to quickly house people into permanent housing, that you won't need that high level of capacity beyond the 50 to 75, as you can see through the modeling that we've done.
So I think it's a balance of enough capacity to really target the folks that are outside tonight and get them into a safe space while trying to move people through with not overbuilding your shelter system to a place where 6 years from now you have a building that you've spent a lot of money on that there's nothing you can do with, or you have to redevelop.
That's great. That's great. We are on about time, I think.
Yeah, I think we're out of time. For the work session. I appreciate everybody's patience as we tried to work through it. I apologize to Commissioner Farr for not getting you a second round.
That's okay.
And with that, I wish I could have given you that. With that, I am going to adjourn the Board of County Commissioners.
And I will close the City Council meeting. Thank you very much for that report.